My name is Justin Griffin. I'm a family nurse practitioner student with United States University, and we're going to be doing a cardiovascular and a peripheral vascular examination today. Can you tell everyone who you are?
Katrina Griffin.
And do you consent for me touching you and putting this on YouTube?
Yes.
Okay. Well, the very first thing that we need to do before we even start the inspection is we need to make sure that we get a blood pressure lying down and sitting up. We're going to do that with both arms in both positions. We're then going to compare the two to see how they compare. You want them similar to each other. You don't want one like the left really high and the right really low, or vice versa. That's something to check into. All right, first we're going to have the patient lie back at a 30 to 45 degree angle. We are going to inspect her neck. We're going to look for the jugular vein, and then we're also going to look for her carotid arteries. We're going to look to see if she has any erythema, any we'll get to varicose veins, but that's down below. We're going to check for any swelling or any abnormalities in the neck. So can you look to the right here? I see it here, her jugular vein. We're actually going to look at the very top of that, and we're going to mark it with a card. We're checking for venous, jugular venous pressure. This can show us if she has like heart failure or hypertension. So what we're going to do is you're going to take the very top of the jugular vein. You're going to put the card there. Then you're going to take a measuring tape or a ruler, and you're going to find the top of the sternal notch, and you are going to put that there. Try and have that come straight out. Sorry, I'm doing a very good job with that. And then you're going to measure it. And hers is about 1.5 to 2, which is a normal find, and you want it to be below 3. Anything above 3 shows that we have increased pressure. Next, we're going to have her, again, continue to look to the right. As you notice, I'm on the right side. Sorry, check to the left. I'm on the right side looking at her, and I'm going to palpate for her carotid artery, which I feel, and then look back towards the right. Good. Palpate it there. Good. Look back. And then you're going to listen to them with both sides of the bell. You're going to check for any bruits while you're doing that. Look that way. Now here it's good. I don't look back towards me. I don't hear anything that kind of sounds like a cat purring. That would be a bruit. Okay. And next we're going to go right into the inspection of the chest. With the chest, you want to specifically look kind of at the sternum. In this case, make sure that there's no abnormalities. Let's say the sternal border is bumped up or concaved. You're also looking for anything that's pulsating at you, including in the aortic kind of area. But she doesn't have any of that. Nothing's abnormal. She doesn't have any abnormal hair growth or something of that nature. From there, we're going to palpate 5 different locations. They're going to tell us where each of the, or we're going to palpate over each of the areas that you would normally feel a certain valve. So the first one would be your aortic valve. That's going to be over your, in your second intercostal space, right sternal border. So when you touch here, you find it 1, 2. And you should actually feel a little pulse. Going to the other side, that's going to be your pulmonic valve. That's going to be your second intercostal space, left side. That's touching there. From there, you go down to the third. This is going to be your Erb's point, so your third intercostal space, left sternal border. Fourth will be your fourth intercostal space, left sternal border. That's your tricuspid. and then you're going to go to the fifth intercostal space, but subclavicular. This is going to be your apical. Now, you should be able to feel both of these pulses here, and this is also your point of maximum intensity. So you should be able to feel your herb's point palpitations, not palpitations, pulsations and pulse, and you should also be able to definitely feel it at the apical spot. After you get done all those sections, you can feel over the aorta. You might be able to feel that there. If you push down hard enough, I'm not going to beat up my patient. I can't feel it just from the palpation like that. But next, we're going to go into auscultation. We skip percussion for this because they just say that it's not worth doing. So again, aortic valve, which is your second intercostal space right here, and with the diaphragm. Good. Then we're going to go back. Second intercostal space, left side. Good. Third intercostal space, herb's point. Fourth intercostal space, again, tricuspid. Fifth intercostal space, subclavicular, is mitral, also known as PMI or apical. Okay. And then you want to listen on inspiration, probably at the pulmonary artery, because you're listening for an S2 split. So when you have the patient take a deep breath in, and on inspiration, you might be able to hear the aortic and pulmonary valves usually close together. One will actually close at a different time, so that's called an S2 split. That can be normal. It may not be. It may need a little further workup. Next, we're going to go right into the more vascular standpoint of this. So we're going to take off her coat and check all four extremities. You're checking for warmth, you're checking for pallor, you're checking for edema, you're checking for varicose veins in the legs. You're also checking for hair to see if she has any. Sorry, I didn't mean to tickle you. You're checking for hair to see if there's hair or extra hair present or no hair at all. If there's no hair at all, we worry about other vasculature problems. You're checking her hands for cyanosis and capillary refill, where you press down and coming out. Same thing on this hand. Press down, coming out. Press down on the toes as well, and everything looks good. Next, from there, you want to palpate each vascular point. So the radial point, the brachial point, the aorta, the femoral, the popliteal, the tibial, and the pedal pulses. So the first one we're going to feel here, and grade here, which is what you want, would be brisk without a thrill. It is brisk with no thrill. Same thing with brachial. You're going to do this on both sides. Radial, good, and brachial, good. Then you're going to feel for the aorta. We've already can't remember if we listened, but we're going to listen to it just to be sure. We're also going to listen to the femoral here in a second, but we're also going to feel. And again, everything again is +2 and brisk. Have her bend her knee up. Good. She's ticklish, so I'm going to make this quick. So I'm just going to touch here. Good. Come back on this side. Touching there. It's good. Drop her legs back down. Tibial on this side. Tibial on this side. You have your pedals. Good. And they're all +2 in feeling. Next, we're going to listen to her aorta. And again, we're looking for bruits, that kind of cat-like purr. Do it with both there and the diaphragm. I don't feel it, or I mean I don't hear it. Again, we're going to do the same thing here, same thing here, and flip it back to the regular side of the diaphragm, the bell, and I don't feel anything there. Again, while you were listening to the heart, I didn't mention, I should have, that you're looking for like murmurs or regurgitations or a different heartbeat or a dysrhythmia, and anything that sounds kind of off. And that's the end of the assessment. Thank you very much for watching.